Hi guys, this is Dr. Bhupesh once again for you all, and today we are going to discuss a topic that our students have asked for. It's speaking topic. Uh, I don't know how hard it is. Uh, I'm just gonna check it out, and we'll make sure that you all understand. So that is the topic you have asked me. Intensive care unit. The patient is 67-year-old, hospitalized for exacerbation. Exacerbation means aggravation of chronic obstructive airways disease. He is worried and anxious about her husband or wife who collapsed while visiting him. So basically, what is happening in this role play that the patient was inside, but our real patient is the spouse who has fallen while visiting the patient. So maybe husband was inside and wife came in to visit. She collapsed over there. Collapse means she had a kind of a breakdown or she fall down, and then her husband wife complained of sudden chest pain and then fainted. She had mentioned that she had calf pain in the leg over the previous week. So means now husband is telling that my wife also explained me that she is having a bit of a calf pain last week. A pulmonary angiogram revealed a large clot, so an urgent ablectomy was performed. Afterwards, he was transferred to intensive rehabilitation care unit in a stable intensive care unit in a stable condition. Means now spouse is stable. Reassure the patient and answer her questions. Maybe the patient will ask about his wife. Explain the strategies to the patient for the prevention of clots, such as not crossing her his legs while sitting. Answer the patient's question and reassure that their husband and wife is currently in a stable condition, and that when discharged, regular blood tests will be advised to ensure no risk of future clots. So you have to ensure that there is nothing to worry. She would be fine. Explain to the patient that she can look out for in order to avoid this happening again. So I can truly understand the topic is basically it's little cumbersome. If exam something like this comes, it would be much clear topic. In this topic we are getting confused that who has fallen down and who has not. So basically that might have been your concern as well. So basically I will read again. So patient is 67-year-old, hospitalized, COAD. He is worried and anxious about her husband who collapsed. Her husband complained of sudden chest pain and then fainted. That is what happened while she was visiting. So, oh, sorry, while he or she was visiting. Suppose we will take one scenario that where we are talking to the husband and the wife came in and she collapsed and she complained of sudden chest pain and she collapsed. She had mentioned that she had calf pain in the left leg over the previous week. So that is what husband is saying, that my wife also complained of this thing. A pulmonary angiogram revealed a large clot, so an urgent ablectomy was performed for the wife. So maybe the wife, she required this operation or kind of procedure, pulmonary angiogram. Afterwards, she was transferred to intensive care unit. So now the wife is stable. She came here to meet the husband. She fell down. So now you are reassuring the patient and answer his questions. So husband is asking the questions that what happened to my whatever. Then you will explain the strategies that prevention of clots can be done this and this and this way. And then you will talk about the patient's question and reassure that his wife is currently in a stable condition. So that is the topic. So obviously I understand what would have caught you. You would have got confused like what is happening. But then I am telling you the scenario. Again, this is a typical speaking, but in exam it would be clear. So it would not be like his husband, her husband. So it will not confuse you. But yes, in this case, obviously you are getting confused. That is why maybe you have asked for this role play. So if you want me to do this role play, I will take just 3 or 4 minutes to tell you. So good morning. My name is Bhupesh. I'm a nurse and I'm taking care of you. So how are you feeling now, Mr. John? Well, nurse, I am all right. I'm not worried about myself at the moment. You are taking care of me in a right way. But I'm concerned about my wife who came to visit me. She complained of a sudden chest pain and she fainted. So I don't know what has happened with my wife. Don't worry, Mr. John, I will explain you everything. First of all, I would like to tell you that your wife underwent pulmonary angiogram, which revealed a large clot. So, an urgent ablectomy was performed on your wife. Oh my God, nurse, like, is my wife in real danger? No, now she is in stable condition. and that is why she has been transferred to intensive care unit, and but now she is in stable condition. But nurse, what happened to her? Before I can help you, I would like to ask you, did she complain of anything in the past? Yes, nurse, I can remember that she was complaining of sudden chest pain and she fainted. And even in the last week, she was complaining of calf pain in the left leg over the previous week as well. So last week also she said that. Okay. So I have noted down these points. So I would like to tell you about the strategies because she was found with a clot. So I would like to tell you that clots can be prevented, so she has to take care of few things like not crossing her legs while sitting or lying. Are you getting my point, Mr. John? Well, nurse, yes, I am understanding, but I'm really concerned about my wife. What happened to her? Well, see, I have already explained you there was a clot, so she collapsed, but now she is in stable condition. There is nothing to worry. So these lines are very important that you have to reassure the patient that there is nothing to worry and she is in currently stable condition, and when she will be discharged, I would like to advise you and your wife that it is very important to undergo regular blood tests so as to ensure that there are no future risk of clots, as clots can be a dangerous thing, so it is very important to be taken care of. But nurse, like, I don't know what to do when I would be discharged. I am already suffering from a disease, now she is also suffering from a disease. Who will take care of us? Don't worry, this is additional line you can say, don't worry, we will provide you all the help and all the guidelines. And also you should be glad to know now that your wife is in stable condition, so there is nothing to worry. Now the last point, she can look out for in order to avoid this happening again. This point does not make too much sense because it is again about that regular blood test. So you can say that also I would like to advise you that your wife should keep on visiting after certain intervals, like after a month, which doctor will give you the protocol. So please advise your wife, and you can also come along to make a regular visit so as to keep on regular checks so that there is no further clot formation. Are you getting my point, Mr. John? Yes, nurse, I am understanding, but I am really worried. Again, Mr. John, I totally understand that you have got little worried, and obviously it is a matter of concern. But with our expertise, I would like to tell you that there is nothing to worry, and doctor also has checked your wife. She is in stable condition, and we are going to take care of you both. And I reassure you that we all are here to help you. Is it all right? Okay, nurse, then it's all right. Okay, then take care. Now you lie down for a while. Also, I will go and will check your wife's status once again, just for your confirmation, so that I can relieve your anxiety. But what we have got as a part of report is that she is absolutely fine. Is it all good? All right, take care. Now you take some rest, and I will come after 5 minutes after checking condition of your wife. So that is how you execute these role plays. I understand this is a very difficult role play, and today you would have faced many challenges in speaking. But in exam, again, you would be having a very clear cut role play. You will not be getting confused like this role play, and you just have to speak nicely. Please listen to this recording 2, 3 times. Obviously, I understand it's little cumbersome, but listening to it again and again will make you feel comfortable how to handle difficult role plays. This is Dr. Bhupesh from Dr. BKM Institutes. Please subscribe our channel if you have not and contact us for the best OET coaching. Our number is 76967 34256. Thank you.